So then we're all set. We're ready to go?
Already.
All right. Thank you very much for your patience. And hello, everyone. This is Dr. Rosita Arvigo. I'm speaking to you from Belize in Central America. And as you know, our topic today is painful periods and the wandering womb. So I hope by the end of the slideshow to make it clear why uterine position is so important in considering causation of painful menstruation. Next slide, please. Okay, and I always would like to give honor and respect and gratitude to my teachers. The first is Don Eligio Ponte, the old Maya shaman, who lived to be 103. And I was with him here in Belize for 13 years as his apprentice. And during that time, I observed Don Eligio treat more than 50 women each week. Generally, his client load was as many as 100 people per week, and about half of those were women who came with menstrual and fertility issues. And Don Eligio gave everyone the same abdominal massage, which eventually became to be known as Maya abdominal massage. So the effects were tremendously impressive. I began using his techniques in my own clinic as a doctor of Naprapathy, which is an offshoot of chiropractic from 1907. So I was able to use these techniques on my own clients for a full 10 years before I began teaching. And I had that clinical practice in Belize for women and children for 42 years. Most of my clients were women. I practiced with my husband. So he took care of men and boys. I took care of women, children, and infants. So over 42 years working with almost exclusively with women and children, I have learned a great deal about women's health, especially as it relates to the abdomen and the pelvic floor. And Ms. Hortense Robinson, she was a herbal midwife, very famous in Belize, as was Don Eligio. So I had a full 10 years with Ms. Hortense, who was my friend and also a teacher. So I honor and respect these two, and just want to state that the information primarily came from Don Eligio and Ms. Hortense, but that I did spend 20 full years researching the anatomy and the physiology behind their incredible success with an ancient form of Maya massage over the abdomen. Nope, next one, please. So the structure of the uterus, here we see this beautiful and magnificent organ. Things I want to point out to you. Here you see the fallopian tube. Now, more properly now, we are referring to this as the uterine tube because it's another example of a male researcher, scientist, anatomist from hundreds of years ago in Italy, Giuseppe Fallopio, who first named them as a result of cadaver studies. So fallopian tubes or uterine tubes, ovary, and then you see the rest of the body of the uterus. Now, the thing I want you to pay attention to is the blood supply. Here you see a uterine artery, and here you see an ovarian artery. Now, the uterine artery comes from a major artery that is right here, the external artery, and it branches off here to feed the cervix, and all of these spiral arteries complete the blood supply, which is the life force. The chi, the energy, the life force, the function is all in the blood supply reaching the organ. So this comes from the side over here, and then the artery that feeds the life supply to the ovary actually comes from way up under the diaphragm. So that is essentially very important because that's why it has to be abdominal therapy. That's why we don't call it pelvic floor therapy. It has to begin in the upper abdomen where the diaphragm sits way up here, and the diaphragm is the solar plexus. The solar plexus is where we all store internalized, unspoken emotions. And so the diaphragm becomes tight. And I'll show you where the blood supply from the diaphragm to the ovary comes from just under the diaphragm, way up here. And it goes retroperitoneal, comes in and goes around right here to feed the ovary, the fimbriae, see, it's really hard to stop saying fallopian tube, to feed the uterine tubes, the cervix, and the body of the uterus itself. Now you see that the ovary is spiral, all curled up in here. The reason for that is because the uterus has to grow probably almost double in size during menstruation. And of course, from the size of a small pear to a watermelon in pregnancy. And then please notice the veins. Now we know that the artery brings in the life supply. It brings in the hormones. It brings the vitamins. It brings the minerals we eat to try to feel better, to try to make our body healthier. All comes through to the organs, to the systems, through the bloodstream, the red blood. And then, of course, we have to have an exit strategy for every organ, system, gland, and cell in the body to remove waste or to carry away deoxygenated blood from the organ. So these are all together. You see the artery on this side, and on this side you see the vein. But the artery and the vein all run alongside each other, and they are separated here so that you can clearly see arteries and vein. But what this shows you is the incredible amount of arterial and venous blood that is in the uterus. And this blood is essential for normal function. Okay, the next slide. And so here you can see the uterus in sitio, if you will. Now here, this is the uterus, is the uterine tube, and up here behind the uterus would be the ovary. Now the blood supply, as we mentioned, the all-important life-giving force, the source of chi and energy that makes everything in the human body function, comes here is the ovarian artery way up here. And it comes and goes around, will you see it here? Goes outside the peritoneal sac and comes back in through here, feeds the ovary and a portion of the uterus. Now the key, as I mentioned, the diaphragm is right here, okay? So the diaphragm is the solar plexus. And the solar plexus is where we all store internalized, unspoken, negative. We can't see the cursor. We're indicating things on the image. Oh, because my partner doesn't have the cursor. All right, so look up, you see the large artery at the top. Right up there, right there, thank you. All right, now I see you're controlling it. And then you see the small artery coming off on my right and the left-hand side. You see the small artery, right, and that makes its way all the way down to the ovary. So if above that ovarian artery, where the diaphragm sits, is emotional muscular tension, all of our hidden, unspoken emotions are stored in muscles. The diaphragm is a large muscle that separates the thorax from the abdomen, the chest from the abdomen. And when we are emotionally upset, when we are in shock, when we are emotionally holding, not allowing our emotions to flow freely, the diaphragm tightens, and all of the blood supply going to the uterus, going to the ovary, is going to be curtailed by as much as 50%. So if we're getting 50% of the arterial oxygenated blood to an organ, we're getting 50% of proper function. If we're getting 50% of venous drainage carrying away the deoxygenated blood, that also carries some amount of waste material from the cell. Whatever the lymph system isn't able to pick up is going to be transferred to the venous system. So if that is unable to return freely and easily through the diaphragm above and back to the liver, then what we have is congestion. Congestion leads to painful muscles. Congestion leads to inflammation, and congestion is a concept that is something terrible all over the body. Congestion in the pelvic floor is especially bad because look how much of an arterial flow and venous drainage is all over here. So here is that external artery, and this artery has a branch that goes to the uterus. We saw that, and up here off of the descending thoracic artery is the vein that feeds the ovary. All right, next slide. So the key to understanding the wandering womb, or where the uterus sits properly in its space in the pelvic floor, is that the uterus is held up by 14 ligaments. Here we see some of these ligaments, by no means all of them. Put your cursor, please, on the top portion. So at the top there, thank you. Yeah, right there. So we're looking, first of all, from the top looking down, as if you were in your diaphragm, looking down at your pelvic floor. So you see the body of the uterus, and you see the large sheet-like object that is the broad ligament. I always wondered if that's why they called women broads. Might have been something that the medical doctors in the 1800s started saying. Why else would they call women broads in the gangster land? So the broad ligament attaches the uterus from wall to wall, side to side, right? And then here, just above and around, wraps around the colon, is the uterosacral ligament. This attaches to the sacrum behind the colon, right there. All right, and then you have in here, you have where the ovary is. You see a string-like body of a ligament called the suspensory ligament. That's right, and that goes through the peritoneal sac that encases all of the abdominal organs, goes through the sac and makes its way up through the abdomen, and that attaches at the third lumbar vertebrae. It's quite amazing. So we have the uterosacral ligament closer to the bottom of the screen, and we have the round ligament, as you see, at the top of the uterus is the round ligament that makes its way to the perineum. It has fork-like structures that attach around to the labia. And that, of course, is the ligament that can give so much pain and trouble during pregnancy. And an abdominal massage during pregnancy often corrects that. One abdominal massage over the pelvic area when a woman is pregnant will quickly correct round ligament pain, which is frightening to women, especially those first pregnancy, because they're worried that something is wrong, something bad is about to happen to their pregnancy, when it is simply this ligament having a hard time stretching itself from 6 inches to 18 inches. So this is a there is another ligament that attaches the ovary to the uterine wall at the side. Maybe you could find your cursor there, right to the ovary that attaches to the, you can see a little ligament there, attaches the ovary to the uterine wall. Now, the ligaments are important because the womb wanders around in the pelvic floor because the ligaments have either been overstretched or they are too tight. So let's say when we get to the causes, you will see why. And on the next slide, please. And so here we see another view. Here is the sacrum, the back there part. Sorry, put your cursor on the sacrum at the back side, right there. So there is the sacrum, and under that is the colon. And in front of that is the uterus. And in front of the uterus is the bladder. Those two red lines coming out from the side of the uterus, those are the round ligaments. And you see how far they have to go to travel all the way to the labia, right down where the pubic bone is. So why they have to reach about 18 inches. And if the uterus is not in proper position, when a woman gets pregnant, then that is a tremendous amount of pain stretching a ligament that may have been contracted because perhaps the uterus is too far forward, often laying on top of the bladder. And so that causes the ligament to contract. And so when she gets pregnant, that round ligament is supposed to stretch easily, allowing for the fundus of her uterus to rise and the uterus to get larger as her pregnancy progresses. But if it has been contracted, because the uterus has been laying on top of the bladder for many years, that is why it hurts. And a simple uterine massage, stretching and stretching upward, helps that ligament to stretch, and it also improves the blood supply. Now, the thing about the ligaments to understand is that while a muscle in your arm receives 100% of blood supply, all of the ligaments that hold your muscles and hold the uterus up in its position receive only 5% of the blood supply of the uterus itself, which is also a muscle. So what does that mean? For instance, where there is a rich blood supply, healing is quick and easier than where there is a less amount of blood supply, because all of the repair materials come in the bloodstream. So now the other ligaments that we're looking at, you see the uterosacral ligament behind the colon. Just behind the colon, the uterosacral ligament, that is the one that prevents the uterus from falling backward up against the colon. Sometimes it does not succeed. For instance, if you fell off of a horse, if you fell down a flight of icy stairs, or if you fell off of a porch onto your low back, it is such a shock to the ligaments that ligament, that uterosacral ligament, can overstretch, allowing the uterus to fall forward, or it can contract, trying to hold the uterus in place with the brunt of the fall on the whole pelvic floor. So then the uterus goes backwards, lying up against the colon. And when it comes time to menstruate, now the uterus is heavy. It's holding about 4 ounces more of menstrual fluid, and it is too close to the colon, puts more pressure on the colon, and that puts more pressure on the sacrum and all of the nerves that exit from those sacral foramina, the little openings in the sacrum. And that most likely is the cause of low back pain with the beginning of menstruation. Now, there is a common symptom of a uterus that has fallen backward, or known as retroversion. Soon as menstruation begins, a stool happens. So often menstruation and stooling come together. This lady with a retroverted uterus because of a weakening uterosacral ligament or a shocked, overstretched ligament will often complain of painful intercourse with a guy in certain positions. Not always, but certain positions. So in certain positions, the entrance of a penis is likely to feel quite painful. In other positions, it won't be painful. So that's one of the key symptoms, that coitus is painful in some positions. And then you see the ligaments on the side. There's the cardinal ligament. That is the ligament that is responsible right along. That's it. Thank you. Right along the bone there. It attaches from the side of the lower part of the uterus right to the pelvic bone there, ilia there. That is the ligament that is responsible for that medical concept as uh, incompetent cervix. Two of the worst words medicine ever put together. Imagine telling a woman that her cervix is incompetent. Incompetent is you are not able to do your job. Basically, you are not reliable. And so it's a really bad message under any circumstances to give to a woman. But that ligament will be loose and lax. And because the ligament is lax, it cannot hold the cervix in its proper position or with the right amount of opening at the os. And so contents of the uterus during pregnancy are not safely held by the uterus, because the weight of a pregnancy will cause the opening of the cervix to be more open than it should at the wrong time during the pregnancy. So that often is caused by severe falls to the sacrum, or where the hips are misaligned. You can see that little V-shaped at the very, very top of the sacrum. If that is too far forward or too far backward, what we refer to as an anterior hip, when the whole of the hip bones rotate towards the front. One rotates to the front, one rotates to the back. So one of those cardinal ligaments is going to be contracted. One is likely to be overstretched. And at the bottom, you see the pubovesical ligament right there. Right, exactly. That maintains bladder position with the uterus so that the uterus does not fall over the bladder. But when those ligaments are not in good standing, not in good tensility, neither too tight or too loose, but just the right amount of tension in the ligament. And remember, ligaments get 5% of the blood supply of the uterus. So they are less likely to heal as quickly as, say, an injured muscle or a bone that gets 100% of blood supply. So when ligaments are damaged or injured, say during a harsh fall to the sacrum, pregnancies too close together. The local women, Miss Hortense, the herbal midwife, always said that every pregnancy ideally should be 3 years apart. And that's how long it takes for ligaments to contract to their normal state after a pregnancy has stretched them to their maximum. And so a weak pubovesical ligament is going to cause a great deal of urinary urgency, especially during pregnancy and also at any time of life, also for women, elder women in postmenopause. All right, next slide. So just again, this is one of our favorite images, the cervical ligaments working in synchrony. This is what it looks like looking down. You see the symphysis pubis, that's the front. Right. And then the way to the back, at the top, you see the sacrum. That's the back. And there you can see the rectum. You see how those uterosacral ligaments go right around the colon and attach to the sacrum. Now, if something happens to those ligaments and their tensility is affected, imagine if those ligaments are too tight. Clearly, you can see that they are going to be squeezing the colon. So one of the things we see is those tight uterosacral ligaments will pull the uterus retroverted, and they will also cause difficulty with stooling because the colon can actually be constricted, almost strangled by the ligaments of the uterus, and that can lead to chronic constipation. So the ligaments to the side, of course, are those cervical ligaments, the cardinal ligaments. They're called Mackenrod's ligament. And again, they hold the uterus in the central position, and they give strength and tensility to the closure of the cervix and the os until it is time to open and birth a baby. And to the front, you see the uterovesical ligaments that surround the bladder. Okay, the next slide. And one more, I'd like always to point out, you see the uterosacral ligament on the right-hand side, the second one down. I just want you to see how large and wide that uterosacral ligament actually is. And that is the ligament responsible for holding the uterus above the bladder and away from your backbone. When those ligaments are damaged, because most primarily as a result of a fall to the sacrum, which, believe me, is incredibly common. And many of those falls happen in childhood. And that means that a woman who maybe fell off a horse, in my environment, fell off a tractor, fell off a front porch, got kicked in the backside, down the stairs full of ice. That means that that sacrum and that uterus can be way too far to the back because the ligaments have been injured in a serious fall. That is number one in causation of the wandering womb, where it tends to fall backward due to damage to the ligaments due to an accident or a fall. And we have to also give some kudos to the support of the pelvic floor muscles, the red that you see at the bottom. The uterus maintains its proper position because of the pelvic floor muscles and those 14 different ligaments that connect the uterus to all north, south, east, west, upper and lower aspects of the pelvis. And there you see way over on the left-hand side, the round ligament again. Over there, that's it, thank you, the round ligament, and you see the little fork-like structures at the end of it that attach to the labia. Okay, next slide. So this is the position of the uterus as is normally presented in many textbooks. And I am here to tell you this is a bad mistake. This is the way medicine has often portrayed the uterus laying on top of the bladder. Look at that poor bladder. She's not even pregnant. What happens is that when these artists drew these early drawings, they mostly worked from cadavers. And very often we know in our abdominal therapy profession that about 75 to 80% of all women in the world will experience a misplaced uterus and painful periods. So it is most likely that 80% of all female cadavers that make their way into a cadaver anatomy lab have a misplaced uterus, and medicine has begun to believe that it is normal. It is not normal. If I speak sometimes, not always, with medical doctors, they say, that's an old myth. The uterus cannot move around in the pelvic cavity. It most certainly can. It's as though there is a structure that weighs from 4 ounces up to 25 pounds, hung by flexible cords that are easily damaged. And when those cords are damaged, they're too loose, of course, the structure has to fall. If those ligaments on the right side are damaged, it is going to fall to the right, maybe to the left. Let's say the cardinal ligament on the right-hand side, or the broad ligament on the right-hand side, is contracted for some reason. All right, so there are reasons, but I won't go into that now. So those ligaments on the right side of the uterus are contracted. That will pull the uterus over to the right side. And when that happens, the ligaments all over the left are overstretched and no longer reliable. So I just want to caution you that when you see a side anatomical drawing like this, the uterus should not be lying on top of the bladder. Eventually, what this situation will cause, can you bring your cursor right between the uterus and the bladder, where there is no space, right there? That will eventually cause adhesions. And I have known dozens, maybe 100 women whose uterus has adhered to their bladder because it has been forward for so many years. And now when it comes time for this lady to menstruate, it is going to be difficult and painful because she's in that position, lying over the bladder. And if it has been that way since she was 8 or 10 years old when she fell off the second-story porch, and ever since then she's had painful periods, it means simply that the uterus cannot do what nature meant it to do, to stretch for menstruation and then to contract back and forth, contract in and out to allow the uterine fluids to pass. But if the uterus is adhered to the bladder, that is very, very painful. As it grows, it puts pressure on the bladder, and she has to pee all the time during that week before menstruation, because now the uterus laying on the bladder is so much heavier. Okay, the next slide. I get caught on these slides and I can go on forever. So this is what the wandering wound looks like. You see way over to the left is normal. Now look at the space between the bladder and the uterus. There's the space. In the previous anatomical version, which everybody takes as sacred knowledge, the bladder is too close to the uterus. The uterus is sitting on the bladder. Now you see the space between the bladder and the uterus, and that space between the back of the bladder and the front of the bowel. Now on the next one, we have a retroverted uterus. Now when this lady begins to menstruate, she will often say that on the very first day, her blood comes with poop. Why? Well, look, when your uterus is contracting, that's what we experience as pain. It should be able to contract just enough, just lightly, so that all you feel is a flutter of your organ doing just light little movement. But in this case, as the uterus begins to move the muscles that it has, it begins to stimulate the bowel. It's like massaging the bowel. It causes peristalsis. And that's why she poops with her menses. And if you look at this one and the next one, retroverted and retroflexed, you can see why intercourse in certain positions is going to be painful, most likely doggy style with the guy. it's going to be where it's ouch, ouch, ouch. And what the guy tells me is, I don't want to hurt my wife while we're making love, so we haven't made love in months because it hurts her. What's going on? This is what's going on. It's probably too far backward. Could also be painful if it's too down, down lower into the vaginal vault, which you'll see next. Okay, so there we have normal, retroverted, leaning backwards, and retroflexed. Means that the top portion of the uterus has bent over, and the fundus, or the head of the uterus, is now pushing into the bowel. The other thing that happens when it's chronic, this lady will not only have painful periods, but she will also have thin, pencil-thin stools as a rule. Often, as you can see, that the uterus is in a upper portion of the lower bowel. The stool may come out normal size, and all the rest is pencil thin above the lower part of the colon. The stool comes out pencil thin. That is one of the classical symptoms or signs. Okay, anteverted, there you see it. Now you see that obviously, if you look at the first one and the last one, the uterus is anteverted, meaning it's bent over and it's leaning too far over onto the bladder. All right, next one. All right, the optimal again, have a good look at that. This is pelvic organ prolapse, which is more common than most people realize. So you've heard of the term cystocele. You look at the bladder in the first image and look at the bladder in the second image. The first image is where the bladder was meant to be, and the second image, the bladder has now fallen into the vagina. And obviously, this is going to create a lot of bladder issues. And then if you look at the next one, the uterus has prolapsed into the vagina. Now, that one is going to cause so many painful periods. The uterus is now encased in a sheath where it was never meant to be. It's meant to be where the cervix is at the top of the vagina, but not the uterus. And so what happens here, remember all the ligaments that we showed you? Pretty much every ligament here has, this is often due to pregnancies with large babies too close together, so that the uterine ligaments, of which remember there are 14. In this case of the uterine prolapse, all 14 ligaments have been compromised to the point that they can no longer hold up a 4-ounce organ. When they were made by the divine creator goddess to hold up 25 pounds. So it gives you an idea of the result of falls, and I have a list of all of the causations of this, but the severity of losing ligament tensility in the pelvic floor, this is the result: a prolapse into the vaginal wall, into the vaginal vault. Now, you can imagine how painful intercourse with the dude is with this. She can't put in a tampon, and her periods are excruciatingly painful because the uterus is now encased in walls. From one to both sides of the uterus now have a wall around it that was never meant to be. And finally, the uterus can fall backward, as you see on the rectocele, fall posterior or backward right into the bowel, into the colon. And of course, that is going to cause painful periods, and also the same issue of as soon as the blood starts, the stool comes with it. Okay, the next slide. So the causes of the displaced uterus. First of all, let me say that if the uterus falls to the right or to the left. Those are two possible positions. There are about, could be right, could be left. It could be too low, that's 3. It could be too forward, that's 4. And it could be too backward, that's 5. So 5 possible malpositions of the uterus. And when they happen, let's just say that the uterus is lying on the right, which is the most common malposition. It's not too low, it's not too backward, it's just way over to the right-hand side. That is going to compromise the blood supply coming from the heart, coming down. As it comes down through the pelvic, it's going to encounter this 4-ounce, 8-ounce, 10-pound ball where the blood is trying to flow, and it will deter the normal blood supply to the uterus. Therefore, the uterus cannot contract and relax easily. It's really hard to do that because it doesn't have sufficient oxygen, hormones, minerals, and all of the wonderful things we try to put into our body. All of the vitamins and minerals that come in our food are not making it to that organ. And if it falls backward, it is going to cause a painful period as well, because now it is laying on top of its own nerve supply, because the nerve supply to the uterus comes from those lower part of the spinal column, the sacrum. And with the uterus pushed backward up against the bowel, and the bowel pushing up against the sacral nerves, all nerves are exquisitely painful to pressure. And so the nerve may be not functioning properly. Therefore, it cannot send the sufficient messages to the uterus to do what nature intended her to do painlessly. Painlessly. I always tell my clients that your menstruation should be 30 minutes of mild discomfort. 30 minutes of mild discomfort. And then you should feel your menstruation flow, and it should be painless, not being in bed for 2 days out of every month. All right, these are the causes. Falls to the sacrum that we discuss. Scar tissue on the sacrum means poor nerve supply to all of the pelvic organs, including the ligaments. Ligaments require nerve, they require blood supply, they require venous drainage, just like every other aspect of your physical body. Carrying heavy things, especially during menses and during pregnancy and too soon after childbirth. I've been in Central America now for 50 years. And one of the things that you hear women say over and over again is, I can't carry heavy things. That means I'm menstruating, I'm pregnant, or I have a pelvic floor issue. I can't carry heavy things. And here, everybody rushes to her aid because we all know what that means. She carries something heavy while she's menstruating. The weight you put, say you're going to just pick up a 10-pound weight, maybe a grocery bag. Your pelvic organs already put 50 pounds of pressure on your uterus just being alive. There's 50 pounds, maybe 35 to 50 pounds of pressure on your pelvic organs just to be alive. Now you add 10 more pounds or 25 more pounds, and that is excessive, and it forces the uterus into the vagina. Motor accidents, being hit from the back, will cause the uterus to, if it were able to fly, it would probably fly 30 feet forward. And so that causes the uterosacral ligaments to overstretch, and the uterus drops over the bladder. And if she doesn't get some abdominal therapy, it will stay that way for the rest of her life and cause nothing but painful periods, and then also trouble with childbirth, trouble getting pregnant. Domestic violence. I'm sorry to say that it happens that women get kicked in the backside and kicked when they're down by their violent partners. High heel shoes seems rather innocuous, But when you put on a 3-inch high heel, and now 4 inches and 5 inches is common, it throws your body balance off. It sort of forces you forward, and your brain and your lower sacrum and those muscles around your pelvic floor have to pull you back to prevent you from falling forward. That causes undue amount of strain on the lumbar muscles and the sacrum, muscles around the sacrum. And the nerves from the lumbar join up with the sacral nerves to feed your uterus, your ovaries, your uterine tubes, your cervix are all given their life support, their life supply from those nerves in the sacrum. And if they are injured, because that's not, in this case of high heels, they're not going to be injured, but they're going to be overly tight. And therefore they squeeze the nerve as well. We all know that a tight muscle can cause what feels like a deep, deep pain that's caused by the nerve squeeze, the muscle squeezing the nerve. Excessive straining at stool, you're pushing down and pushing down. And if your ligaments are already challenged, just that forcing down is enough to cause the uterus to fall into the vagina. Difficult pregnancies, too close together. For instance, I had a client who was a Maya woman who was about 5 feet maximum. She married a Dutchman who was 6'2", and all of her babies by nature were meant to weigh 5 to 6 pounds. She was birthing 8-pound babies that nature never made her to do. But she was able to do it, yet her uterus and her uterine ligaments all suffered. So that she had chronic problems after each delivery, and they were also too close together. Now, when I saw her, her last baby was already 10 years old, and she came because of painful periods. All right, excessive pushing during childbirth. Now, the over pushing during childbirth, now the ligaments are holding up an organ that could easily weigh 25 pounds. Let's say there's twins or triplets that could be 30 pounds of baby weight, placenta, water, and the growth of the uterine muscle itself. So excessive pushing during childbirth can overstretch all the ligaments of the uterus, and it can fall in any of those 5 positions and be the absolute cause of painful periods because the uterus is lax and slacks. It's not getting good blood supply. It's not getting good nerve supply. Sexual abuse. When we are sexually abused, we hold the memory, we hold the trauma in our muscles. The uterus is a muscle. So the uterus itself and the pelvic floor muscles that also support the uterus can be in a chronic state of contraction because of an inability to share, to know that it was a violent, traumatic experience, not the way women or girls should be treated, but the awareness nevertheless may not be in the mind, but it definitely is in the ligaments and the uterine muscle. Emotional holding of past traumas. You know, when you're holding a lot of tension, your muscles get tight. When you are holding on to secrets, your abdominal muscles get tight. When you're holding on to painful memories you haven't been able to share, the diaphragm will tighten, and that will mess up your digestion because all of the blood supply to your abdominal organs that are responsible for digestion, the blood supply may be cut down by 50%. Therefore, you have 50% normal function. The blood supply to the lower portion below the abdomen also comes through the diaphragm, where as the solar plexus, we all hold internalized, painful, negative, unspoken emotions. Next slide. Symptoms of the displaced uterus. Number one is always painful periods. It's always going to be there, simply because the uterus doesn't have proper arterial supply, venous drainage, lymphatic drainage, nerve supply, and chi. Whether it's to the right, to the left, it's too low, it's too backward, or it's too forward. All of those malpositions due to injury in the structures holding it up, the pelvic floor muscles and the ligaments, all of those malpositions will lead to chronically painful periods. Dark blood at the beginning and at the end of menses. That, in our abdominal therapy profession, is one of the primary key signs and the question we always ask a client with painful periods. Do you see dark blood at the beginning and dark blood at the end? If the answer is yes, that means your uterus has not been strong enough to sufficiently remove all of the menstrual fluids from month to month, and they build up and they thicken, they oxidize, and they get dark, just like any blood that falls to the ground. And so what we see looks like chocolate syrup, looks like coffee grounds sometimes, and often has a bad odor because it's been in the uterine membrane for the last 10 or 15 years. A backache with menses, you saw how close the uterus is to the colon, and a retroverted uterus pushes the colon into the sacrum. The sacrum is irritated and sore. And as the uterus grows with more menstrual fluid, it puts more pressure on those delicate nerves. Stool comes with menses. We discussed that a couple of times. Heavy feeling in the pelvic floor. That also is a primary symptom. That heavy feeling in the pelvic floor where it feels like something is about to fall out. That uterus is too low, may not be fallen yet prolapsed into the vaginal vault, but just sitting too low with the cervix too close to the top portion of the vagina is enough to cause very painful periods because it can't move properly. It's being squeezed and tightened. And it feels like it feels like a baseball on the bottom of your pelvic floor. That is not normal when you're getting close to your menses, or the first two couple of days of your menses. Once the woman starts to bleed, she feels that heaviness in the pelvic floor alleviate. Headache with menses, primarily because of the constriction of blood vessels that the uterus is laying on. So the arterial blood is meant to move through your body every 30 seconds, from toe through your brain, that back down to your toes every 30 seconds. When that is not possible because there is a 8-ounce organ laying on a vital large artery in your pelvic floor, then the blood flow is not moving. So the arterial blood it has to go up and the venous blood has to come down. So where there is arterial congestion, there is always going to be venous congestion. And the vein carries deoxygenated blood. So if the brain is not able to drain properly, then you have deoxygenated blood carrying normal waste material. It's not like toxic, it's just normal waste material. And that normal waste material and deoxygenated blood damage and irritate the nerves and the brain itself. Fertility challenges. It can be difficult to get pregnant and stay pregnant if your uterus is off to one side or the other. I remember one lady who was 22 years old, just got married. A year and a half goes by and they're not pregnant yet, and she has terrible, painful periods. And what I found was that actually her cervix had adhered to her pubic bone. It was so retroverted that it was lying flat across the floor of her pelvic floor, flat, so that the cervix was actually adhered to the pubic bone. How is she going to get pregnant? How does she have menstruation? It was just leaking out and falling into the vagina. But trying to get pregnant, the sperm was not able to make it. That was once and only once that I find that in 42 years of a clinical practice. And it was corrected with 6 abdominal therapy treatments. 6 abdominal therapy treatments, and it has to be abdominal, not just pelvic, because we have to assure that the diaphragm above is not in a state of chronic emotional tension, not allowing the blood to flow properly. So what it comes down to is hemodynamics, the free flow of blood through the system. Miscarriages are going to be very common. I think we made that clear. Difficult labor and childbirth. The uterus is not properly receiving its hormones. It's not getting what nature intends it to get when it's time for the cervix to open, time to let this baby come out. And also she's got congestion from the venous blood, insufficient nerve supply, insufficient venous drainage. Next slide. We're almost done. Treatment for painful periods. This is what we do in abdominal therapy. This is what I train our practitioners to do in our classes. Abdominal therapy to lift the uterus and strengthen the ligaments once or twice a month. Sometimes it takes 1 treatment. Sometimes it takes 6 treatments. We can't really say for sure. But we know by the end of the 3rd treatment, there should be dramatic improvement. Abdominal therapy to normalize nerve, blood, lymph, and chi. Those are the systems of flow in your body. If you don't have good nerve supply, the nerve is the plug in the wall. You can't run any machine if it's not plugged in the wall. And so your nerve from the sacrum to all of the pelvic organs is the plug in the wall. The blood is the life force. The lymph carries away your waste. And the chi, of course, is the energy that comes from the universe. Yoni steams during the week before or on day 1 of the menses. Some women are trying to get pregnant and they can't get pregnant, but they don't want to take a yoni steam during before the period because they might be pregnant, and pregnancy is a contraindication to the yoni steam. So if they take it on day 1, that means they're already bleeding, they're not pregnant. But if they're not trying to get pregnant, then we recommend 3 yoni steams the week before menses start. Now, what would you use for the yoni steam? There are literally hundreds of plants that could be used to alleviate painful periods. Here in Central America, the most common are basil, oregano, and marigolds. Marigold, basil, and oregano. Castor oil packs, 3, I can't now, there's a thing, 3 something over my castor oil packed 3 times 1 week before menses. Castor oil packs allow, better venous drainage and better lymphatic drainage as well to decongest the pelvic floor. The woman may have to eliminate dairy. If we don't get results after all of this, she is having a difficult time eliminating the glue left over after dairy. Just think, whenever you see a cow in the field, the cow is always drooling mucus. So dairy is mucus forming. If she is unable to eliminate, and some people are not able to eliminate the mucus left over from digesting dairy, if we take away the dairy or eliminate the dairy, she feels tremendously better. I would say maybe of my 42 years, 20% of clients had to eliminate dairy to overcome their painful periods. Hydration is absolutely essential. Your uterus needs to be well plump with normal body fluid and water in there so that it can do what nature intended. No lifting of heavy things before and during menses. Keep the feet warm. Keep the feet warm. I cannot say that often enough. The issue is if you are barefoot on floors that are cold, if your floors are heated, well, that's okay. But if you're barefoot on tile, not the earth, but if you're barefoot on artificial floors that are cold, then you are preventing venous return from your pelvic floor and from your abdomen, so that then there is venous congestion. Cold things contract. The veins have to move down through your abdomen, through the diaphragm, down through the abdomen, down your legs, and then turn and come back up. The blood supply the arterial blood goes down and the venous blood has to come back up again. So if the artery and vein, where they switch from artery to vein, meet a cold foot that is contracted, your cold feet turn blue. Why do they turn blue? Because the venous blood is congested. Therefore, as above, so below. As below, so above. If your feet are congested, your pelvic floor is congested. Emotional clearing of past traumas. That is something that happens naturally and effortlessly after and during an abdominal therapy session. When we begin to massage the areas where the emotions are being held, where the memory is locked, because they're in the muscle and your issues are in your tissues, as we put our hands on with loving, tender care, and all of our therapists tune in to their spiritual guidance before we touch a woman's body. So with all of that in place, a woman feels comfortable and free, and her emotional body, even beyond her conscious decision, is willing to let go. And so what happens often during a session is tears begin to fall. Sometimes painful memories emerge, and we simply say, all we do is hold space. I tell my students, we are not therapists, we are not psychologists. We are simply here to remove the blocks to emotional clearing. And those tears that come are lifesavers. Those that come with no connection, I don't know why I'm crying, I'm just crying. These could be ancestral memories, these could be in utero memories, and these could be memories before the age of consciousness. Okay, next slide. And so I'll leave you with this. The female pelvis is a powerhouse of energy transformation, the very throne of creation, through which universal creative energy patterns course and flow. And the next slide, there is contact abdominaltherapycollective.com, and I'm simply rositaarvigo.com. And now I will take your questions.
Thank you so much, Dr. Rosita. I think everyone really appreciated that. If anyone has any questions, the floor is yours. So just go ahead and unmute and ask away.
I think there were some in the chat, huh?
I have a quick question. First, I want to say thank you so much. Is there a way that you could immediately understand if the patient has an issue with their cervix versus their uterus? Or do you have to do like a further like physical examination to see, because the symptoms, I guess, can be similar sometimes?
Honey, it really doesn't matter whether it's the cervix or the uterus. If it's the cervix, it's the uterus. If it's the uterus, it's the cervix. It's kind of like saying, if there's somebody has, can you tell if it's the hand or is it the forearm? They're all going to be connected. There's going to be symptoms in both. If the cervix falls into the vaginal vault, it's going to cause some serious inflammation. And if she gets an exam, somebody looks at it through a speculum, they're going to see a lot of swelling, redness, and sometimes accumulation around the cervix. But we don't do internal examinations. We have midwives, we have nurse practitioners, we have pelvic floor therapists who do internal exams, but most of my students do not have that licensure. So I would have to answer that if it's happening to the cervix, it's happening to the uterus. Next question.
Hi, I had a quick question.
Yes,
Oh, I'm sorry.
Nope, you go ahead.
I had a question, Dr. Rosita. Thank you so much for this. This was awesome, and so eye-opening to me. I'm wondering on your list of things that can be causing damage to the uterosacral ligament and the pelvic floor, have you noticed anything related to like chronic sitting down? Like if a woman works in an office or is always, you know, seated in an office setting, and for 6, 8+ hours a day, has that been, in your experience, impacting uteral health?
Well, the uterine artery goes through the psoas muscle, passes over the psoas muscle. So if the psoas muscle is contracted for 10 or 12 hours a day, yes, that can cause some lack of proper, we can never say no blood supply, that's impossible. That leads to necrosis and death. But it would restrict the blood supply to the ovary. The ovary has its own artery, so it may not affect the uterus. However, the other issue is if she's sitting in tight blue jeans. Sitting in tight blue jeans for hours every day, or even wearing tight blue jeans all the time, is going to constrict all of the fluid, all of the ways that the body maintains its normalcy and homeostasis. It's going to affect the return of the venous blood. It's going to affect the flow of the arterial blood. It can affect the position of the uterus by all of that constriction around the pelvic floor. But primarily, it's the venous, the lymph, and the arterial supply that is going to be affected by chronic sitting.
Thank you so much. Thank you, Bree, for letting me go.
Yeah, of course, no problem. I just wanted to say thank you to you again for this presentation. It was amazing. Had a lot of light bulbs going off. I have a friend who deals with vaginismus, and so I had put in the chat earlier, I was curious about, I know it can be psychological and from trauma, but I'm curious about if there's things, if vaginismus can be connected to some of the things that you're talking about, and if there's things that she might be able to do to address it. I know the yoni steams maybe, but anything else, any other insight?
Absolutely. Yes, the answer is absolutely yes, connected, and absolutely yes, will improve. I've treated hundreds of women with vaginismus, and it is mostly due to venous congestion. When the veins of the pelvic floor are congested, there is going to be an accumulation of acetic tissue and fluid, and that causes tenderness to touch. Certainly when there's an object ramming into the vagina and there's vaginismus, yeah, it's going to be very painful. But in my estimation, for what I have experienced after treating thousands of women, is that it is due to the venous congestion, and it may be related to the nerve supply to the vagina as well, that it is insufficient, it's not getting life force. So could be the arterial blood isn't arriving, so actually the vagina is starving for its own life force. So yes, absolutely.
She's vegan. Thank you for that. She's vegan as well. Could diet play a role in terms of if you know, we're not getting enough of something due to our diet?
No,
Okay.
I don't think so. No.
Okay, thank you. Thank you so much.
Another question from the chat was, how do we separate the uterus and the bladder? Only through surgery, question mark?
Only through massage. The massage takes the uterus and lifts it away from the bladder. Lifting, that is the only time the uterine massage is somewhat painful. When the uterus has adhered to the bladder after 10, 15, 20 years of having the uterus anterior laying on top of the bladder. The only time that it is painful because we are pulling tissue away, but it is avascular. It has no blood supply. So it doesn't cause any tissue. It doesn't tear the tissue of the bladder, and it doesn't tear the tissue of the uterus. They simply separate, and it can be painful as they separate because they're adhered. But that's all we do. We massage externally, and it works every single time. The vaginal steam will help because then it softens the tissue and hydrates and softens. So it's easier to remove the uterus from, not remove, but aid the uterus in getting off the bladder. Get off my back, basically. That make it clear to you?
Yeah, I think that's a great explanation. Thank you.
You're welcome.
And we have one last question here. It describes the brown blood before and after periods, but with a pain-free period and no obvious womb misalignment. Would you still recommend the same protocols here for that if the person's experiencing this spotting on either end of the period?
Yes, I would. Then I would say, often in a case like that, 1 or 2 abdominal therapy treatments or 1 or 2 yoni steams. If you're not able to get to an abdominal therapist, they're on our website, and right now they're actually all over the world. If you're not able to get to an abdominal therapist, your next best bet then would be the yoni steam. It would help tremendously.
Great, thank you. And Lydia's question is also about massaging to get the uterus off the bladder. Does that massage technique work for other types of uterus misalignment in other directions?
Absolutely. That's the only thing. That's the primary use. That is the primary function of the abdominal therapy, is to improve digestion, because all life support comes through the diaphragm. If you're holding on to emotions that you haven't been able to express since you were 4 years old, that's going to tighten the diaphragm. Then the blood supply to all of your digestive organs is decreased. And going further down, the blood supply, the life force to your pelvic organs, getting less than your digestive organs are getting. So yes, all positions are improved by the abdominal therapy. We have a special technique for the retroverted uterus because we're not able to reach it from the front portion, from the anterior wall. We have a very special technique for the chronically retroverted uterus. Sometimes it corrects itself with just the regular massage that we do over the abdomen. Sometimes it doesn't, so then we have a special technique for the retroverted uterus. But you would know that from ultrasound. You might realize that because you have those pencil-thin stools. You have painful periods. You have painful intercourse with the guy. Those are classical symptoms of a retroverted uterus. But to answer your questions, yes, all of those malpositions are corrected by abdominal therapy, taught to us by these wonderful unlettered traditional healers, Don Eligio and Miss Hortense. Neither of them ever went to school, never learned to read or write. But I had to spend 10 full years doing the research to figure all this out. Don Eligio, the old Maya shaman, only told me that the uterus is held up by cords. That much he knew and nothing else. And based on that, I started going through anatomy books, physiology books, and 10 years. 10 years of in private research and study before I started teaching, trying to figure out why the uterus gets out of position, why an external massage can help it get back into proper position and maximum function.
Great, thank you. And I think we have two final questions here if you're open to that.
Sure.
Okay. The first is about vaginal smoking versus steaming. Are you familiar with the smoking technique? And it seems to be a thing in Southern Africa. So the person is wondering if you also see it in Mayan medicine.
I have seen it occasionally, especially during childbirth with copal incense. I believe that the effects would be most likely the same as the yoni steaming because of the heat. I'm not sure what plant they would use for the smoking. If it were an aromatic plant like rosemary or basil or marigold, then I could see that in the smoke would be the essential oil, and then you would be getting the same benefits from a yoni steam. But I personally have not done the smoking techniques. I have seen it done, and the traditional healers wouldn't be doing it if it weren't helpful.
Yeah, absolutely. And the last question is about uterine corrections during pregnancy. They're wondering, is pregnancy a contraindication for massage therapy, or is it, safe to do?
Yeah, absolutely needed and absolutely safe. We have the benefit of relaxin, that hormones that helps tissue to soften and stretch better, which is why also on the other end, if you already have injured ligaments, they may become too loose during pregnancy. And that would be, say, if your uterus is off to the left when you get pregnant and you're holding now not 4 ounces, but 10 pounds, everything on that side is going to start complaining. Your back, your leg, your foot, your shoulder, everything is going to be compromised, all on that side. And during pregnancy, we massage it towards the center, moving towards the center. And yes, absolutely, completely safe and completely indicated for a comfortable pregnancy. I cry. I absolutely cry when I think about how women suffer unnecessary complaints and heavy weight on their pelvic floor during their days of pregnancy. It was never meant to be, and it is a crime to leave women in that state without this simple external massage technique that anybody can learn. Next question.
Does anyone else have a final question for Dr. Rosita? You have the floor. Just give you a moment.
I just wanted to ask if you could speak briefly about binding of the belly and if that helps at all.
Sure, that has to help. I mean, let's say you had an 8-pound baby, and you had a placenta in there, probably weighs, I'm not sure, a couple pounds, and then all of the fluid around it. So I'm sorry, what was the question? My brain was going off. What was the question?
I was just asking about binding of
the binding. Yeah, the binding. It's helpful. Very helpful, yes. All throughout Central America and Africa. In Morocco, I saw the binding. In the Eastern nations and Japan and China, women are bound. It's, yes, definitely. During pregnancy, it's very helpful. It helps the uterus to be in a more upright position. I have been in Central America for 50 years, and some women have 18 children. And so after 10 children, your uterine muscles, ligaments are often incredibly overstretched. I used to work for 2 years at the women's clinic in my local town, and those women who are anjeres, have a baby every year or every 14 months, their uterine ligaments make the uterus feel like a balloon in the bathtub. There's just no tensility whatsoever. So if we bind it and hold it in place, it's an aid to allow your ligaments to repair themselves without holding onto your pregnant uterus, or your uterus that is holding onto fluid that needs to be that needs to be out. So yes, the binding is good, and people all over Central America do it during pregnancy, before menstruation, and sometimes all the time. If there's a tendency for the uterus and she doesn't get the proper care, women will bind themselves every day for life.
Thank you so much for that. Thank you.
You're welcome.
And we have one more question. Do you find the self-care methods of abdominal therapy just as effective as utilizing a practitioner? And what types of healing results do you see?
I'd say 90% as effective. I invented the self-care. After watching Don Eligio do the work, after watching Ms. Hortense do the work, I thought, we have to do this for ourselves, because every day women encounter the causation of a uterus out of proper position. If you work in a store where you're loading shelves, lifting boxes, if you ride horses, if you're a gymnast, if you're involved in any type of sports where you're running, basketball, all of those, soccer, all of those sports where women tend to be running and falling, it is a given that her uterus is going to be affected. And I know for a fact that the women in sports teams suffer tremendously with painful periods, and they give them drugs and pain pills to make it through their menstrual cycle. That's the women's basketball team, all of those, other than swimming. Swimming is the only one that doesn't cause that. Yes. Yeah. Did I answer that question?
I think so. Thank you so much.
Okay.
Well, this was wonderful. I think based on the chat, everyone is very, very honored to be here and to learn from you. So thank you. We're all very much indebted to you. I'm personally indebted to you. 10 years ago when I found your work, and you fixed my periods, and now I help people fix their periods, and
that's great.
Yeah, these convergences can continue to do that and share this knowledge. So yeah, we're very grateful.
It's so important. It's so important. As I said, I cry over women's painful periods and their difficulties in pregnancy, their difficulty at childbirth, because it is preventable and correctable.
Absolutely. I think we all feel that way.
Mm-hmm. Well, thank you, everybody, and thank you for your patience with our tech issues in the beginning.
Yes, we made it work.
Thank you.
I hope you have a great rest of your afternoon.
Thank you very much. Bye, everybody.